Uber has always been big on experiments. We like to try things before we go big. We started with an on-demand flu shot campaign actually in the fall of 2014. So at the time I had been on the Boston operations team. I was helping to launch Uber in the New England market, and our team was always charged with thinking of new and interesting ways to utilize the Uber platform. So if we can, give people rides, we could also deliver things like ice cream. And it was one day where we got an inbound inquiry from a team at Boston Children's and Harvard Medical School who said, hey, you guys are doing on-demand ice cream and on-demand kittens. Have you thought about doing something in the public health space like flu shots on demand? And it really occurred to me that, Uber is uniquely positioned to do something in the healthcare space, mainly because of this access to reliable transportation that can either get someone to the care that they need or get the care to them. So we experimented with the flu shot campaign, and what was interesting about it was that there was a lack of awareness. People didn't know that they should be getting a flu shot, and studies showed that one of the other reasons people didn't get a flu shot was because it wasn't convenient enough. So even though you could get one at any pharmacy or at your workplace, it still seemed not to be convenient enough. So we thought by taking things through the Uber platform, someone could, it would be even more convenient by bringing it to their home or into their workplace. And that awareness piece was pretty easy for us too, because we have this app that people engage with every day. So in 2014, we did it in a handful of cities in the United States. And then in 2015 across the United States, and again in 2016, where for one day, I think it was for about 4 hours that day, you could open the Uber app and request and have a nurse come to you and bring you, a pack of flu essentials and give you the option to get a flu shot. And it turned out that that convenience factor and the on-demand nature of the campaign really did influence people's decision to get vaccinated. So that was one experiment that we repeated over time, which was very interesting, and also I think it kind of got our appetite wet. So we were like, how are people going to respond to Uber in healthcare? And from there, it was a lot of inbound inquiries from healthcare organizations, really all over the world, who said, hey, what you guys have built is interesting, and it's great if someone has the Uber app, but we have people at the front desk of our hospital, who, our admin have, 5 iPhones open trying to request rides for patients. And that was really telling. And so we started to do some partnerships in the space, but we decided that if we want to really do this at scale and impact the greatest number of patient lives, we need to build a HIPAA-compliant infrastructure that will enable us to really contract with these healthcare organizations and let them use our platform to the fullest extent.